Hi, so I wanted to do a little video for you guys. If you don't know who I am, my name is Abby Johnson. I ran a Planned Parenthood clinic, an abortion clinic. I was there for 8 years, and I'm now pro-life. And one of the things that has really been on my heart is to help people with pro-life apologetics. I think a lot of us in the pro-life movement don't really know how to answer questions or talk to people whenever they give us their talking points from Planned Parenthood or the abortion industry. So one of the things that I wanted to talk about first was probably the most common question I get from abortion supporters, and that is, where are these poor women going to go once Planned Parenthood closes down? This past week, I did a talk in Albuquerque at the University of New Mexico, and my talk brought out several groups of protesters. Yay, I'm always excited when they come. And so I was talking to them and just getting some information about why they were there and what they believed in. And Planned Parenthood actually did not send a representative to the table, but they did send some condoms to give out for people that came by. But there was a group there called the Women's Resource Center. And so I started talking to her and, asked her what she knew about Planned Parenthood and why they sent women, why they referred women over to Planned Parenthood. And she told me it was because there was just nowhere else to go for these women to be seen in a timely manner for health checks. So I started asking her what she knew about federally qualified health centers, FQHCs, and she was telling me that the FQHCs in Albuquerque could not see women for an annual exam for at least 6 months, that they made the women wait 6 months. So when I left, I didn't know. I'm from Texas, so I didn't know what it was like in Albuquerque, but I knew that there was no way that there was a 6-month wait. So when I left, I got on the phone and I called all of the FQHCs in the Albuquerque area and asked them if I needed to get an appointment for an annual exam, how long would it take for me to get in? And the longest waiting time that I got from any of the FQHCs was 3 weeks. Now, I have insurance. I always have, even when I was broke and didn't have any money. I never went without health insurance. And it takes me at least a month, usually 4 to 6 weeks, to get in with my OB-GYN for an annual exam. So I don't think that 3 weeks is really a crazy undue burden for anyone. I did ask them if I had a problem, if I thought I had some sort of infection, or if I needed to get in for an STD test because I thought I had been exposed, when could I get in for that? And she told me that they could actually get me in that same week. So clearly what this woman was telling me was not accurate. And that's what we are going to experience a lot of times from abortion supporters. And we need to know how to answer this question. And so what I want you to do and what I want you to research is you can research federally qualified health centers. You can go to Google and you can put in federally qualified health centers. A link will pop up, or you can actually go in and you can look at health centers all around the country. What you need to know is that there are only about 600 Planned Parenthood clinics left in the United States, and they are quickly closing. There are more than 10,000 federally qualified health centers, rural public health centers, community health centers, and hospital health centers. So we have this network of more than 10,000 health centers that all see women who are low income or indigent. They actually have more funding than Planned Parenthood clinics would ever have because they actually provide comprehensive health care, whereas Planned Parenthood only provides very, very limited gynecological health care. So you might hear that Planned Parenthood provides mammograms. You might hear that they provide a lot of different things, but that's not the case. For instance, if a woman came in and she had been told that maybe she had high blood pressure or high cholesterol or something like that, we could see her and we could, of course, check her blood pressure, but we do not have the protocols. Planned Parenthood nationally There is no Planned Parenthood clinic that has protocols to help a woman who has been diagnosed with elevated blood pressure. There are no protocols to help a woman who's been diagnosed with diabetes or elevated cholesterol or anything like that. And so what we would have to do is we would have to then refer them to an FQHC, to a federally qualified health center. So if we're talking about women who are low income, women who are indigent, they probably have limited transportation. They probably have limited child care. So why would we ask them to make 2 trips, to make 2 stops, when they could simply go to one, the FQHC, and that could be their one-stop medical home? Federally qualified health centers, rural health centers, all of these other health centers that I mentioned before, not only do they provide comprehensive health care, but they also provide pediatric care. Most of them have dental centers, and they also have vision centers. So I'm not sure why if we are pro-woman, why we would want women to jump around from place to place when they have limited income, limited transportation, limited child care, when they can go to one place for one stop. And not only can they be seen, but their children can be seen at the same facility. Not only can they get medical care, they can get dental care, and they can get vision care, and there's also a pharmacy on site. So these are things that we need to be aware of in the pro-life movement. It's definitely the most common thing that I hear, talking point that I hear, that women are not going to have anywhere to go, but women are going to be just fine. The world will keep spinning. Everyone will be able to get the health care that they need if Planned Parenthood closes down. We see that all over the country. We see Planned Parenthood closing, and women are not going without health care. They do continue to have health care. There are thousands of Medicaid providers across our country that are outside of FQHC. So there's even more options. There's even more than 10,000 if we looked at all the Medicaid providers. So we need to arm ourselves, we need to equip ourselves to be able to answer these talking points, and we need to do the legwork. When that woman told me that it was going to be 6 months for a woman to be seen in Albuquerque at an FQHC, I picked up the phone and called. And that's what we need to be doing. Call them out on their bluff. Let people know that they are being dishonest and that the information they're giving out is inaccurate. I've never heard of an FQHC taking longer than 4 weeks to see a woman for an annual exam, and I would say that is probably below average for most physicians and most healthcare centers if you're not having a problem. So share this video with your pro-life friends. Pass it around. It's not good enough to say, well, I'm pro-life because I believe in God and God is pro-life. We need to know how to answer these questions, how to come back, how to have a logical rebuttal to what they're saying, and to be able to share with them that what they're being sold is inaccurate and it's a lie. So I'm going to keep doing this, and I'm going to keep, putting out some talking points, and I helped develop some of those talking points where I was at Planned Parenthood, so I certainly have some answers and ways that you can talk about them. But look up the FQHCs in your area. Find out where women can go for health care. If you're a person that goes and sidewalk counsels or stands outside of an abortion clinic, you need to know where those are, so that if you do talk to a woman and she does want to leave and she doesn't want to go to Planned Parenthood, you need to know where to send her. Thanks.